Hello, today we're going to be doing a video podcast about basic life support, and this is my affiliations. So, what is basic life support? So, it's a sequence of procedure would do to restore the oxygenated blood back to the brain after sudden cardiac or the pulmonary arrest before emergency services arrived. So BLS is important because it can be done by anyone. Doesn't include any invasive skill or the use of any medications. So it's essential skill for everybody. So can be delivered by the trained or the non-trained medical personnel, anybody who knows and how to do it immediately without any other equipment, basically. So basic life support is very important because there are like over 700,000 cardiac arrests per year, and then there's a research that early resuscitations can result in the more than 60% of survival. So the indication of the CPR are either the cardiac arrest, respiratory arrest, or the combination of both. So this is the chain of survival in the BLS. So early recognition of the cardiac arrest and calling for more help, early CPR, and early defibrillations in case of shockable rhythms, and post-resuscitation care. And the basic life support would fill the first three initial steps of this chain of survival. So the acronym for BLS, so that everyone can remember, is a CABD approach, which stands for circulations, airway, breathing, and defibrillations. So before we proceed with the BLS process, I want you to fill these few quizzes we can discuss in our face-to-face sessions. Think about how confident are you in performing BLS at the moment if you encounter someone in a cardiac arrest. And secondly, before our BLS course, which part of the BLS process do you feel least confident about? Think about those questions. So let's proceed with our BLS. So since one, when you find an adult lying on the ground, what would you do? So the most important thing is make sure yourself is safe. If you're not safe, if you're in danger, you cannot save another person. So this is the most important step in every emergency procedure. Make sure there's no electricity or spikes around that can cause you danger. So once you feel you're safe, assess for the responsiveness of the individual by shaking the shoulder gently and asking loudly, "Are you all right, sir?" or "Madam?" At the same time, look for the chest wall movement to see whether they are breathing spontaneously or not. If they're not responding and if they're not breathing spontaneously, check for the circulations by feeling the carotid positions on the right part of the neck. Do not check for more than 10 seconds because time is key. If you think the person is not breathing, is not responding, and if you feel like there's no carotid position in 10 seconds, shout for help. This is the most important part of the BLS. You cannot perform effective life support by yourself alone. You need someone to help. Once you get more help, start the CPR. To start the CPR, it is essential that you place the person in a supine position so that you can deliver effective chest compressions. Knee down and locate the position of the chest. So where is this position? So it is located in the lower one side of the patient's sternum in the midline of the chest. Once you identified it, position your hands, lock your arms, and place the heel of the one hand like this over the others, and then they place the other end on top of the other hands, and then keep your elbow straight down with your shoulder directly above your hand so that all the forces of your upper bodies are in place. So compress and so that you achieve at least 5 centimeter chest compressions. So it is approximately around 5 centimeter or 2 inches to get enough cardiac output to get oxygen supply back to the brain. So good quality chest compressions, you need hundreds per minute, and you need to press it hard. At the same time, you need to allow full chest required with each compressions. Remember, the purpose of doing chest compression is to get a cardiac output, so you need to allow the blood to fill back to the heart. So this is the rate of the chest compression that we talk about. So once you deliver initial 30 chest compressions, look for the airway. Make sure the airway is patent. How are we going to do? So there are two procedures. So head tip chin lift procedure is the first one that you can see on the left picture. So place two fingers on the patient chins and then the other hands on the forehead and perform the head tip and chin lift procedure. And the other method to do it is the jaw thrust maneuver. Place your 4 fingers on the patient's jaws and your thumbs on their cheek and thrash the jaw forward. So the purpose of doing both the procedure is to displace the tongue from occluding the airway so that the airway is patent. Once you achieve the airway, trying to deliver to rescue breath by mouth to mouth or the mouth to barrier or mouth to mask if there's equipment available. So the rate of doing so is 30:2. And while you're doing that, allow enough time for the chest wall to rise and then allow time for air to expel from the patients. So the cardiopulmonary resuscitation, one cycle is every 30 chest compression to 2 breaths. So continue the CPR, and it is advisable to switch rule between every 5 cardiac cycle to avoid the fatigability of the chest compression. Remember, it is quite an aggressive procedure and you need to use a lot of the force. So it is think about the human factors about consideration of what can hinder your successful CPR. So the continuous CPR entail, when would you continue? Until the emergency health services arrive, or the victim start breathing normally, or the rescuer became exhausted, then it is reasonable to complete the CPR. So the last process of CPR, C, A, B, and D is the defibrillations. So there are automated external defibrillators called AEDs available in all the public places and in the workplace, which are designed to use by any layman. So you can use it, or the non-trained personnel can use it. AED has like a voice recognition, voice train pattern how to deliver the shock and whether the patient needs to be delivered shock or not. So for your next task, find and report the location of the AED in your workplace and local public area and write a brief report around 150 words whether it is access is adequate for all the persons to use when necessary or not. And we can discuss it in our face-to-face section. So how do you attach the AED? There are two patches usually available. One patch, the right patch, would go into the right chest wall, and the left patch will go into the apex of the chest. And then the AED machine will analyze the rhythm and instruct you whether the patients need a shock or not. So if the shock is advisable, clearly state to stay everyone's clear, and then I'm going to deliver a shock, and then press the button. There's a big red button in the AED machine and deliver a shock. Make sure everyone's safe before you deliver a shock. If the patient stops breathing normally, place the patient in the recovery position. So what is this position? Is the patient's lying on the side, and how do you achieve that? So place when the patient is supine, make the nearest arm at the right angle, and then the farthest arms to the patient cheek, and then the flex the patient knee on the far arm, far legs, and then pull the patient to the side. So this is a position to keep the airway open and allow the patient to recover by himself. So my last take-home message. So taking the right actions, the most important thing in the CPR is to get the right action quickly and confidently, and it will make the difference between the life and death of a person dealing with a cardiac arrest. Right, good luck.